We're back to the Arthur Aidala Power Hour with New York City's preeminent trial attorney and quintessential New Yorker, attorney Arthur Aidala.
Beautiful molar.
All right, what song is this?
It's called The Painless Dentist by Alan Sherman for World Oral Health Day.
And yes, that is what it is. It is World Oral Health Day. And it is, we're making light of it, but your oral health affects so much of your body. So let's talk to Dr. Glick. Dr. Glick, it is Arthur Aidala. Welcome to the Power Hour. How are you, sir?
Doing great. Thanks for the welcome, Arthur.
On a very serious note, tell us how your oral health affects your entire being, the health of your entire body.
Yeah, so many people think that problems in the mouth are just in the mouth, and if they're not feeling pain, kind of just let things ride until they feel pain. But something called gingivitis or periodontitis, which people think of as gum disease when they have bleeding gums or inflammation or things like that, that response to inflammation can cause lots of issues because the bacteria can travel through the bloodstream to the heart and can contribute to some pretty serious overall health conditions like endocarditis and arteriosclerosis, which are serious heart disease. There's links to diabetes, stroke, hypertension. Lots of bad stuff can happen.
And there's something to do with your heart as well, right? Because I know people have like heart conditions. If they're going for oral work, you got to take antibiotics or something. Explain that to me, doctor.
Sure, a couple of different things you're touching on which are important. Some people need antibiotic prophylactically. That's if somebody has a replacement valve, a heart valve, or sometimes some with a heart valve or some for replacement knee or hip, because the bacteria that are in the mouth during routine work or definitely during surgical work can be loosened up and can really get into the bloodstream. And as I mentioned earlier, that blood, once it goes into the bloodstream, can go to the heart, and that's where we talk about things like endocarditis, which is an infection of the inner lining of the heart, arteriosclerosis, which is hardening of the arteries. So that bacteria that's in the mouth can travel to other parts of the body. You mentioned about free medication, usually with amoxicillin, but untreated periodontal disease can lead to, lots of bad things for the whole body.
And, today is World Oral Health Day. So why don't you give some folks some pointers about oral health? I mean, just, obviously there's brushing, there's flossing, there's water picking, there's all kinds of washes. So why don't you give us a little lesson here on, what we should really be doing. I will give it credit to my wife. She's got my 2-year-old brushing her teeth, a 3-year-old brushing her teeth. And I know it's important for those little kids to actually take care of their teeth, but to get in that habit at a very young age. But for us adults, doctor, what should we be doing?
Yeah, I mean, you hit on really, some of the top points out there, but to me, it's really prevention, right? So a lot of people don't go see the dentist until they're in pain, and pain is really a very late stage of periodontal disease, and bad things are already happening both in the mouth and in the rest of the body. So, you've heard this since the beginning of time. Go to your dentist every 6 months at a minimum. Get checked out, and again, once you see inflammation, or if you have bleeding when you're brushing your teeth, when you're rinsing out and you see blood in the sink, all these are bad signs. So you don't want to wait until you feel pain. That's I would say tip number one. And number two is stay away from the really sticky stuff, right? I'm a big Snickers guy personally. After you eat the sticky candies, just make sure you brush your teeth. And if you don't have a toothbrush handy, really, really good idea to rinse your mouth out. Lots of good things. Even if you don't have toothpaste, just rinsing your mouth out breaks out the food particles that can contribute to plaque buildup, neutralizes the acids in the mouth that leads to, lots of teeth breakdown. So those are a couple of pointers other than, the ones that you already mentioned. I'm a big water pick guy, very easy on the mouth, and it just really does a great job.
So, not to be too personal here, but I will, you mentioned about blood in the sink. When I crank that bad boy, the water pick up to level 10, there's some blood there. It's nothing crazy, but, I'm cranking it out, man. I get a full tank of water and I'm hitting those gums and in the back and in the front. And, I would feel like I'm not doing my best if there's not a little bit of red stuff in the sink.
Yeah, I don't know, Arthur, when the last time, we're not going to get too personal, but when, we're not looking at your x-rays or when the last time you went to the dentist. But, again, the blood in the sink can be from one of two things. Some people brush too hard or they brush their gums. There's no, it's not the 11th commandment, to brush super hard. Once you do it I'm a big believer in the soft bristle brush and moderate pressure. In terms of the water pick, you might want to crank it down, one or two notches. You don't have to go to turbo level. Maybe try it at 6 and 7s and see what comes out. I mean, if you're not seeing, food particles or any debris come out, when you're at 6 or 7, and it shouldn't take you to 10, to really get a good water pick session in.
So if you're doing the water pick, do you also need to floss?
So good question. That's one of the big debates within dentistry. I personally, as I said earlier, I'm a big water pick. It's just so much less invasive. Sometimes when you floss, you kind of crank through, you hit the gums hard and then you start bleeding. I'm a flosser probably once to twice a week, but water pick 2 or 3 times a day. So, but you can 2 or 3 times a day.
2 or 3 times a day, you're water picking.
Yeah, I don't mess around. I do not mess around with the water pick. They have these, if you ever, the travel version one, I keep one in my office, one in my house, and it's just, I don't know about you, but after I water pick, it just feels great.
No. I am a big fan. Let me ask you this question. How much has, the electric toothbrush changed your life?
It changed my life. Yeah, no, it's much easier. And
when I say change your life, I mean with not you personally, but
okay.
In other words, my dentist, who I've known for a very long time, and she's treated me. We went to high school together. She noticed. She's like, "Did you start using an electric toothbrush?" I was like, "I did." And she goes, "What else?" I go, I go, "Well, I do the water pick thing too." She goes, "Your mouth is gorgeous."
Yeah.
So, I mean, do you see? Are you able to tell the difference?
It's hard to know. It's a great question. I don't really ask people if they're using, when they were using a manual toothbrush versus using an electric toothbrush. I do recommend it as patients get older, and I'm not saying you're in that category.
I am.
As patients get older, they lose some of their manual dexterity, and it's much harder, especially to reach in the back. So the electric toothbrushes are so inexpensive these days, and they do a great job. So big fan of them. But yeah, I don't really have any studies pre versus post, manual.
Well,
versus
I will tell you.
But,
I'm talking to Dr. Glick, Doctor is a world-renowned dentist. Doctor, I will tell you what the electric toothbrush does do. It's got the timer, and I think all of them do, and it pauses at every 30 seconds. So you're supposed to do like every quadrant of your mouth for 30 seconds, and then you to the 2-minute mark. Whereas I don't know if everyone's got the.
You went to dental school. It sounds
Excuse
like
me?
between the two of us, you might have been in dental school also.
Well, listen, I don't want any issues with my teeth. Yeah, but I mean, I think when you just brush using a regular toothbrush, which is what I do, like when we're traveling or whatever, I don't know if I have the discipline. I know I don't have the discipline. Like, I don't set a timer and be like, okay, let me brush for 2 minutes. Whereas when I use the electric toothbrush, I just brush until it dies. And I think maybe that's the reason why my dentist said my mouth is gorgeous.
Yeah, for sure. I used to, when my kids were young, I used to have those old salt timers. They used to like watching that thing.
Yes, my kids have that. Before I let you go, how about the tongue? Brushing the tongue, cleaning the tongue.
Good idea. Definitely a good idea. A lot of people get bad breath because food and particles get stuck in the papilla. So very inexpensive. You can get it at any of the local drugstores. Tongue brush takes 10 seconds, and a lot of times bad breath comes from there more than other areas. So one of the first things, absolutely great idea, brush the tongue.
Yeah, it's almost like a scraper, the tongue thing, right?
Yep. That's just the papilla that it really.
All right.
Listen, I should be interviewing you.
No. Dr. Moshe Glick, you are at the Riverdale Family Dentistry, right?
Yep.
Well, and you can find him at www.riverdalefamilydentalpc.com. Dr. Glick, thank you for joining us on World Oral Health Day. We really appreciate it.
Thank you for taking the time and spreading the good word.
Listen, great job, great interview. Wednesday night, Arthur Aidala. It's going to be a late night for me here. I'm going to sit down with a couple of the lawyers and go through a whole bunch of evidence on this